I thought I would share some perspectives on the relationship between mentees and mentors. As mentees, I think it's important for each of you to understand both expectations for your role and also to understand the expectations of, because it's a mutual relationship in which you help each other. And so I think it's critically important to sides and to have good expectations of each other. Now, transparency is a critical concept in the context of academic medicine and research. And so typically we begin talks, disclosures, and any potential conflicts of interest we could have. And so I receive salary support from several grants from the United States National Institutes of Health. And I've listed those here. I would point out that the third grant that's listed is an award to Aga Khan University, and Dr. Zainab Samad is the principal investigator. Also, I do receive as the section editor for global health for the up-to-date medical digital textbook. So my objectives for today are to go through a discussion with a definition of mentoring. And I think that's a critical platform upon which we start our discussion. I'd like to talk about some of the common problems in mentor-mentee relationships and how we can potentially overcome some of these challenges. Tools that can be helpful in terms of having a common understanding of expectations of mentees and mentors. I'd like to talk about one particular tool known as a personal development plan. I'd like to talk about soft skills and some of the important soft skills that mentees can gain from their mentors. And then I'll close with some conclusions. So we're going to start with the definition. And mentoring is defined as a learning relationship that's focused on long-term career development to achieve the mentee's personal goals. And I'll repeat that, to achieve the mentee's personal goals. So mentoring is about the mentee and how you can help be successful. And you accomplish this by guiding, building skills, supporting accomplishments, planning, and networking. And it goes beyond supervision. Supervision is quite hierarchical, and this is much more personal, and it reflects a personal commitment to the mentee and her or his goals. Structured face-to-face interactions and unstructured interactions. By unstructured, I could mean things such as attending a conference and helping your mentee to network. So I could introduce you to other leaders in the field. Frequently, I'll invite leaders in the field to come see my mentees' research poster or presentation. It could be that we go out to dinner together with these important people in the network. So it includes both structured interactions and unstructured interactions. The composite is oriented towards facilitating and growing the mentee's career. Concept as a mentee is, how do you select a mentor? What are the potential criteria that you use? And this is an important career development decision. You want to select a mentor that is going to help to facilitate your success. So some critical questions to consider potential mentors, you should ask, what kind of mentorship do I need? Is it research skills and experience? Is it clinical skills? Is it career development? Is it achieving work-life balance? And how I can have a satisfying personal life, my professional goals. As you assess a potential mentor, I think it's important to look at her or his time commitments. Sometimes what happens with the most popular mentors, so many time commitments, they can't commit to actually helping the mentee. So it's critically important to assess their capability of supporting the mentee. One of the ways in which you can ascertain commitments is to speak with past mentees and ask them, what has the quality of the interaction, and does the mentor seem committed to help you as a mentee? Also, you career development pathway of past mentees, and what kind of success have they achieved in reaching their career goals. And it's important to have a mutual assessment of, you want to know that your mentor is going to be open in speaking about expectations. And you want to know that the mentee can communicate back to the mentor her or his expectations, and if they're being met. Now, occasionally, we make poor choices for a mentor, and mismatches can occur. And we're going to talk about some ways that those mismatches can be handled. But this is a critically important process of how you select a mentor, and it has a big impact on the success of the mentorship process. Now, there have been identified 4 pillars of mentoring. Mentor will practice and exhibit these characteristics. It includes trust. It includes mutual respect. It includes clear communication of expectations, and it includes frank and honest and sincere communication. And so you want to select a mentor who can exhibit these characteristics, and also that you feel comfortable that you can share those characteristics with her or with him. So there are some common problems that can be encountered in mentoring. I have found that the biggest problem that people can encounter is meeting as scheduled. Now, each mentor-mentee relationship may have different expectations for how often you should meet. My personal approach to this is I ask mentees to meet with me weekly. There may be times when we have to cancel because one of us will have a conflicting commitment. But it's critically important, I believe, to have a regular meeting schedule, whether it's weekly, every other week, month. And it's critically important to adhere to that schedule as much as possible. Now, that can be disrupted by conflicting time and energy commitments. Frequently, this can occur because of clinical commitment, and we can't always control the clinical emergencies or the clinical workload, but we have to do the best that we can. Sometimes there are unrealistic expectations. So I try to communicate to mentees their responsibilities and for their career development and progress. Also, there may be unrealistic expectations of mentors. A mentor cannot make or break your career by herself or himself. The mentee has to be actively participating. So we want to avoid over dependence on the mentor. Sometimes there can be unfair manipulation. So the mentor may, for example, impose upon the mentee excessive work. And the mentee has to be able to express that and say, given the balance of responsibilities that I have, I simply cannot fulfill that commitment. And or jealousy from other mentees if they think that there's favoritism. And there can be ineffective mentoring pairs, and I'm going to talk about some potential mechanisms by which the relationship can be repaired, or if necessary, can be replaced. So how to overcome these problems? As I mentioned, it's important to set regular meetings into the future. These have to take responsibility for attendance. And this comes down to a respect time. remember that most mentors are not compensated for mentoring. Mentoring is something that's done out of goodwill and a commitment to continue the tradition of for young people. So mentoring is a volunteer activity for the most part, and is of love for the profession. It's important to adhere to the schedule, and if there of time and energy, it's important to communicate those and try and correct them. Mentoring objectives and goals are set during the initial meetings. And I think the mentee ability for identifying her or his objectives and goals and communicating them. And we'll talk about this in more detail. It's critically important to remember that the relationship is about the mentee is the focus and her or his success. I do think it's important for mentees to take responsibility for regular reporting of progress and the challenges that. So I ask mentees to come with a progress report, and I'm going to share with you a template for how a progress report could look. If the perception of manipulation exists, consult with a mentoring manager. So you have to have a third party if there are problems in the relationship. And that third party could be a department chair, it could be a more senior colleague, any number of potential ombudsmen who could mitigate these problems. Transparency can help to counteract resentment or jealousy. And if there's a mentoring mismatch, a change in mentors, and this mentoring manager can assist. And this is something that's difficult. Relationship is not functional, then it can be quite problematic. Now, some people have called mentoring contracts. And of course, a contract involves two parties, the mentee and the mentor. And I'm not going to read this whole slide, but I think if you peruse it quickly, you can see some of the critical concepts. And I'll just start with the first one for the mentee. I acknowledge that I have responsibility for the development of my own career. So the mentee has to be participatory and pushing for their needs in their career development. And so you can see the whole list, and I'm happy to share these slides if anybody would like to see this. Then, of course, you would also expect that there should be a mentoring contract for mentors. And that's something that's critically important. And I have been asked to sign for my trainees. And again, I think that the first bullet point, most important concept, and it says, I acknowledge that the mentoring period is a time of advanced training intended to develop the skills needed to promote the career of the mentee. And that's what's critically important for mentors. The mentor focus is the success of the mentee. And we'll greater detail. But again, you can see each of the potential listings on the contract. Now, an important tool that helps to facilitate communication between the mentee and the mentor is something called a personal development plan. It's also known by the acronym PDP. In the context of a personal development plan, you discuss career goals. And typically, I think of short-term and long-term career goals. You know, what are the immediate things that we need to take care of? And that's typically less than a year. Medium term is a year to 3 years, and long term is beyond 3 years. You have to make an honest assessment as the mentee of your current skills and accomplishments. And this is critically important because if you identify your skills and what you've achieved so far, you also see, and you want to be able to fill those gaps, and with an explicit plan to address want to gain a particular skill set. It may be that you haven't published enough and you want to focus on publishing more papers. It might be that you want to build a reputation in the field and you will want to attend conferences, scientific reputation. So identifying the gaps is critically important. Then resources to address the gaps. It could be, as I said, a particular skill set. It could be a particular experience. It could be a clinical skill. It could be improving manuscript preparation. And so you have to look for the resources that will give you the skills to handle those gaps. Then you want to set timelines, and you want to have a particular timeline that you set out that helps you to gain those gaps. You want to be able to review this regularly with your mentor. Here's my progress on each of these issues. And then finally, a personal development plan should identify opportunities for growth. So if you aspire to a leadership position, how can you accomplish those key milestones so that the end product is you end up with leadership skills and being considered as a candidate for a leadership? All of this can take place in the context of a personal development plan. And I ask my mentee with a draft PDP, and we review it and we refine it to make it a roadmap for success. So what mentioned earlier, I think it's the mentee's responsibility to tour with regular progress reports. And this could include progress on different studies, career development. It could include budget issues, both for research and also for clinical activities. It can include an update on manuscripts, because as academicians, we are measured by our scholarly output. It could include travel plans, attending conferences. If you have some work overseas, I think it's important to include that in the progress report. Eventually, your mentee may want to start making grant applications to obtain external funding for their work. And then the mentees themselves. So if I'm mentoring an infectious diseases fellow who is a postgraduate, he or she may have medical students who are helping. And so the infectious diseases fellow is acting as a mentees, and that could be part of the progress report. So this captures quite a few important activities of the mentee and reports them in an organized fashion to the mentor. Now, I also think a mentee can get from the mentor some soft skills. What do we mean by soft skills? Well, these are skills that are generally taught by personal example. So the mentor shows by personal example to the mentee how to accomplish and deal with some of these issues. At the top of the list could be handling conflict. If there's conflict, how does the mentor approach it and work through, mitigate, and solve the conflict? Also, I think a mentor can exhibit the skill of upward management, how to address superiors and get what you need. And this is something because you want to be able to have some ability to influence your superior and to get the resources you need to accomplish your goals. I think a mentee can watch a mentor build a team, and building a team and having a functional team is critically important. How do you assess the functionality of a team? How do you put together a team? What kind of skills are you looking for? Help to maintain a functional team. Another soft skill is negotiating contracts. So we may have to negotiate budgets in the context of our career. And how do you acquire those skills? And I think a mentor can exhibit those skills and by personal example, help to teach a mentee how to negotiate contracts and budgets. I mentioned earlier the issue of networking, and by this, I mean scientific networking. other important individuals in the field and connect with them and build a network of cooperative and potential collaborators. Then there's the issue of peer reviews. So many of us get asked to review either manuscripts or grant applications. And I think it's important to involve a mentee in this process when possible, so that you can how a grant review or a manuscript review or a grant application takes place. Also, there are issues of grantsmanship. So putting together a grant proposal can be quite complicated, and it includes both the objective components, but also some subjectivity. How do you present it to make it clear to your potential reviewers so that it increases the likelihood of funding? Cultural competency is something that, and I think in the context of Pakistan, it principally involves how do you handle gender issues, and how do you have fairness in handling men and women, and how do you accomplish that in a way that communicates absolute equipoise and commitment to what is. So these soft skills can be quite important. Now, also as a mentee, you have to have some assess your mentor. And there are a number of potential metrics that you can consider. Is the mentee satisfied? What are the benefits and costs of the relationship? Is the mentee getting career guidance with a proper planning process, and then advancing this process so that the career is advanced? What about academic productivity? Is the mentee accomplishing scholarship as an author on manuscripts? Does the mentor put the mentee as the first author on her or his work, on the mentee's work, and recognize the mentee's contribution? So, and then also the impact of the scholarship. Do they promote this work? Do they share this work? I mentioned earlier and how you meet other researchers and have a network of potential collaborators, scientists. I think assessing a mentee, assessing a mentor, also has to think about wellness. What about work-life prioritization? And is the mentor an example of wellness? And do they have a proper balance? Also, a mentee can assess mentoring capacity, organizational diversity, and mentoring activities by the mentee are all ways in which a mentee can help to assess a mentor. Now, sometimes some programs will have a mentee evaluation form for the mentor. And this is an opportunity for a mentee to give explicit feedback to the mentor. And you can see here the list of questions. And we'll first couple. Was your mentee easy to approach and talk with? Does your mentor an encouragement for you with respect to your independent goals? Do you meet regularly? Do you receive regular feedback and constructive criticism? And then you can continue to go down the list. These factors that can be important, because all of us as mentors want to get better, improve our ability to mentor. And another example of an evaluation form is here, and it's important concepts: your partnership, personal growth, and our relationship. So these are tools that can be helpful. Now, another concept is peer mentoring. So in some circumstances, senior mentors may not be available, may not have mentoring skills, or may not have a mentoring commitment. In some settings, mentoring academically productive. So in United States contexts, we're asked to list our curriculum vitae, and our mentees' successes are demonstrate success for the mentor. Now, in some settings, that isn't the case. And in that setting, peer mentoring may be important when these challenges exist. Peer groups can help identify needed research skills and request opportunities to gain those skills. Peer groups can critique study design in a way that's helpful. Also, they can assist with writing manuscripts and adhering. And that's something that's critically important. So mentoring is like parenting, and you create a family tree that's passed from generation to generation to generation. And that is a critical concept. If then your mentees are going to be successful mentors, and that just gets passed on from one generation. And so that is critically important. So a few conclusions. The most common challenges in mentoring relate to keeping scheduled meetings due to conflicts of commitment and lack of communication. So I think this is something that is critically important. The mentee has to make clear progress reports because it helps the mentee to stay organized or to identify potential problems and gaps. Mentoring contracts and personal development plans can be useful resources. Soft skills matter and can be shared, especially by mentor example. And as a mentor, and when I was a mentee, I found that the mentor-mentee relationship can really be fun and can be tremendously rewarding. And so I close with a picture of my who was an important mentor to myself. And he's shown here when he was the dean of the Aga Khan School of Medicine, and His Highness is there with him at medical school graduation when they were handing out diplomas. Grateful that you have listened to me. Now I'd like to take comments or questions that you might have.